Thank you for trusting us with your upcoming surgery. We will do everything we can to make sure you have a good experience, starting with this video to help prepare you for surgery. Following these instructions will ensure you have the best outcomes after your surgery. The information includes advice on diet, physical exercise, smoking cessation, breathing exercises, required lab tests, and infection prevention practices. Please remember that your cooperation and willingness to follow these recommendations are important for a positive surgical experience.
Your body needs fuel to heal, so it's important to make sure that you are getting all the nutrients you need to recover fully. Eat balanced meals of whole grains, fresh fruits and vegetables, and lean protein. Eat modest portion sizes. For example, one portion of meat should be about the size of a deck of cards. Eat slowly until you're just satisfied, not stuffed. Make sure you drink enough fluid. Most people need at least 6 8-ounce glasses of water or other healthy fluids per day. On the day of your surgery, only drink clear liquids, up to 6 hours before arriving to the hospital. Some examples are clear juice, water, tea, and black coffee. Depending on certain health conditions, your physician may recommend that you drink a high carbohydrate drink the night before and the day of your surgery. And please refrain from eating and drinking after you arrive at the hospital.
The stronger you are going into your surgery, the better. It's important to be active before your surgery to help strengthen your heart and lungs, as well as the rest of your muscles. Being active before surgery can reduce postoperative complications and help you come out of your surgery feeling better. If you're currently unable to walk, follow the chair exercise handout in your packet. If you can walk only 1 or 2 minutes at a time, follow the modified walking program. If you're able to walk more than 2 minutes, follow the active walking program. Duration is more important than intensity. Therefore, walk at your own comfortable pace. It's better to walk for a longer amount of time at a slow pace rather than walk a shorter distance because you walked too fast and became tired. So listen to your body with any activity. Your physician will help you decide which exercises are right for you, both before and after your surgery. So remember, the stronger you are going into surgery, the better.
After your surgery, it's really important to breathe deeply. This will help prevent complications with your lungs. You'll be asked to use an incentive spirometer that will help encourage you to take deep breaths. This device measures how deeply you can inhale or breathe in. It helps you take slow, deep breaths to expand and fill your lungs with air. This helps prevent lung problems such as pneumonia. Detailed instructions are in your packet, and your respiratory therapist will show you how to use the device. This is one of the most important things you can do while you're recovering from your surgery. It's very important to refrain from smoking before and after your surgery, and this may be a good time to consider quitting for good. When using the spirometer, sit up as straight as possible. Do not bend your head forward or backward. Hold the incentive spirometer in an upright position. Place the target pointer to the level that you need to reach. Exhale or breathe out normally, and then do the following. Put the mouthpiece in your mouth and close your lips tightly around it. Do not block the mouthpiece with your tongue. Inhale slowly and deeply through the mouthpiece to raise the indicator. When you cannot inhale any longer, remove the mouthpiece and hold your breath for at least 3 seconds and then exhale normally. Repeat these steps 10 to 12 times every hour when you're awake, or as often as directed. Also, a very important part of your recovery exercise is to cough after your deep breaths. If you are having abdominal surgery, using a pillow will make this easier. You will place the pillow over your incision site, squeeze tightly, then cough. And please, if you have any questions, don't hesitate to ask your nurse or respiratory therapist.
Another important way to keep you safe is to make sure everyone that takes care of you has a complete list of your medications. Be sure to include your prescriptions and over-the-counter medications such as vitamins, minerals, and pain relievers. Also include inhalers, topical creams and ointments, patches, eye drops, ear drops, nose drops, and injectable drugs such as insulin and implanted pain pumps. Please include how often you take your medications and any other special notes. Check your list several times before surgery. A form is included in your packet to make it a little easier. We also need to know about any allergies and intolerances. Please be as specific as possible when listing the medication and reaction you experienced in the past. This will help ensure that we don't give you something you're allergic to while you're in the hospital. Many of your medications may have special instructions about when to stop taking them prior to surgery. Your physician or scheduling nurse will give you specific instructions 1 or 2 weeks before your surgery. You should know that all the medication you will need while you're in the hospital will be provided here. When you go home, you will be given a detailed instruction sheet about which medications to take, and new medications may have been added while others may have changed. Please, don't hesitate to ask questions throughout your stay if you don't understand something. And finally, it is often helpful to have your new prescriptions filled before you go home. For your convenience, Cadillac Hospital has a discharge pharmacy located on the 3rd floor, and your nurse can help fill your prescriptions before you leave. There are also several nearby pharmacies as well.
You play a significant role in reducing your risk of surgical infection. Following a few simple steps before and after surgery will go a long way in reducing your chance of infection. Before surgery, please read the information packet that has been given to you. Follow the directions you have been given to use the chlorhexidine wash. Do not shave your surgical area. Make sure you clean under your nails with the nail brush provided to you. Brush your teeth 2 times every day and use mouthwash the day of surgery. After your surgery, the single most important way to prevent infection is to wash your hands. You may use soap and water or hand sanitizer. Wash your hands before and after eating, using the restroom, or touching animals. Ask your visitors to wash and disinfect their hands before they touch you, and do not touch or scratch your incision. If your dressing becomes soiled, please tell your nurse. Staff will sanitize their hands every time they enter your room. If you don't see them do so, please ask them to sanitize their hands. After you leave the hospital, follow your surgeon's orders for taking care of your dressing. Look at your incision site at every dressing change. If you see any drainage of cloudy fluid, redness, or increased swelling, call your doctor or home care nurse. And call your doctor if you have or think you have a fever more than 101 degrees. We want to keep you safe from any type of infection that could prolong your stay or make you return to the hospital. We wish you a speedy recovery. Just a few simple steps is all it takes.
And one more thing, if at all possible, bring a family member or friend with you to the hospital to support you on the day of your surgery. We hope this information has been helpful, and please, contact your surgeon or primary care provider if you have any questions. You're an important part of your surgical team, and how quickly you recover depends on what you do, so please, spend time reading the packet of information that you have been given. We look forward to seeing you soon.